when you do it, a lot of these things that are taboo, and a lot of these things to do with pain, to do with anguish, and what I'm dealing with a minute to do with, I suppose, apprehension, are to do with the fact that you think you're the only person going through it. And unless there are ways to connect with other people, it can be quite a challenge. So the day is officially marked tomorrow with the aim of spreading more awareness. But we want to find out a little more. Here to help us is founder of Achalasia Action, Silvia Davey. Hello, Silvia.
Hi.
How are you?
I'm well, thanks. How are you?
I'm all right. Thanks for coming on, because it's a bit of a weird one. But when I heard it, I thought, well, I want to know more. Certainly people who live in London. What is achalasia?
So essentially, achalasia it's a rare swallowing condition. So essentially, in people with achalasia, the normal movement of the esophagus or your food pipe doesn't work anymore. So the food pipe essentially can't propel food down to your stomach. So what happens is that food remains stuck in the esophagus or the food pipe, and often people with achalasia must be regurgitating this food or have to swallow it with kind of really painful gulps of water. And obviously that kind of impacts on how people with achalasia eat and experience eating. And that can kind of lead to really extreme weight loss and kind of impact also on kind of energy and also cause anxiety and depression.
Well, I was about to say that because the thing is, and here's stupid question alert, right? Well, how do you know you've got it? Please don't say because you can't swallow properly, but you can't. No, that's what some people would say to me. You can't swallow properly, but you don't know what it is, and that's got to be quite terrifying, isn't it?
It is. I mean, I'll speak about my personal experience. I developed it when I was 17, and the first symptom that I remember was kind of swallowing, or trying to swallow, and then the food got stuck kind of in the middle of my chest. So, when you eat a big piece of bread sometimes a bit too fast and it stays stuck. So that was the first symptom.
Did somebody have to come behind you and perform a Heimlich maneuver? Did you get worried like that?
No, it just did go, it went down easily enough, because obviously the food pipe is different to the windpipe. So no Heimlich maneuver required, thankfully. But yeah, so it just causes, the start was just a lot of pain every time eating. But, I got misdiagnosed the first time I went to the GP about it.
What did they think it was? But hold on a minute, because they deal with a lot of stuff. I went to see my GP the other day and they started Googling, which made me feel really weird. But that's probably not the sort of thing that comes up every day when you're doing your medical exam, is it?
No. I mean, I have had, the medical profession has been amazing in supporting me, but I have had medical professions saying, oh, you're the first person with achalasia that I've ever met. I studied you in my first year. We had a list of kind of rare diseases. Achalasia was the first one because it starts with an A.
So you're a protect. So you're special.
Special, rare. Exactly.
Well, I mean, they're aware of it now, and they're trying to make moves to teach medical students about it. That's movement, isn't it? Or is that something that's easy for me to say?
Pardon? Sorry.
Is that movement? Is that progress? That here is a medical student that has an acknowledgement of something that you have, which is extremely rare.
I mean, it's progress, definitely, but I think what we hear every day with the patients that we support at Achalasia Action is that they are experiencing very often a late diagnosis, a misdiagnosis, and kind of that delayed diagnosis has a really big impact on a person's physical and mental health. It can be really, really profound. And we're at Achalasia Action, we're actually doing a project to better understand people's experience of getting an achalasia diagnosis. And part of what we do as well is to try and raise awareness, to try and get medical professionals to hear about us more often than just maybe in that first year medical kind of module on rare diseases.
How rare is it then?
So in the UK, there's around 6,000 people who have it. So it's around 10. It affects around 10 in 100,000 people. So it's pretty rare.
And in just take me through your diagnosis, because this is something that I'm hearing a lot. My normal producer, though she's not here today, Ella, has something called endometriosis, and it would take between 7 and 10 years to get properly diagnosed, and that isn't as rare as yours is. So maybe there is something that is happening. Is it just coincidence that you're both women, or is it something that women suffer more than men?
Well, we don't think so. So the information we have on how achalasia impacts people is not massive. We don't even know what causes achalasia, but we think that, or the late research shows that we think that it impacts men and women at the same rate, more or less.
What did having the diagnosis improve or change?
Well, having the diagnosis meant that I got appropriate treatment. So although there is no cure for achalasia, you can get different forms of treatment, including surgical treatment too. Just 1 second. What did it mean for you? Something's wrong, and we don't know what it is, and it is changing my life. It is 17, I'm doing A-levels, I'm becoming aware of myself, where I fit in, all the other stuff that's going on, and then you got this thing where you cannot swallow, and it's going on for ages. No one can tell you what it is. I can imagine how anxious you're becoming. So let me ask you the question again, relative to that, Silvia. How did it make you feel to finally get a diagnosis? Well, I must say it was both relieving but quite scary as well. As a 17-year-old, to be told that you've got a rare chronic condition that no one knows that much about, we don't know what causes it, that's quite frightening. And I think that the most frightening thing for me is that I needed to do this. Well, I was advised to have a quite invasive surgical operation. But it was relieving as well, because obviously initially I was misdiagnosed, being told that it was possibly an eating disorder. So it was nice to know that I was I had an explanation for what I was experiencing, essentially. But there was a lot of fear as a 17-year-old, a lot of anxiety.
How are you doing?
I am, I'm well enough at the moment, through actually, I've got, the support of all the people, the patients in Achalasia Action. I am now, supported regularly by a specialist consultant as well, so that's great. I have ups and downs. I think one of the main symptoms that I get now are these esophageal spasms, which cause chest pain that feels nearly like a heart attack. Actually, the first time that I had them, they took me so much by surprise that I went to A&E because I didn't know what was happening. So those can keep me up at night, and they can be difficult. But I'm so lucky I can manage my symptoms quite well. I can, modify my diet, and that means I can eat relatively well as well. But some people don't have the luck that I have. Some people we support at Achalasia Action, they experience really difficult symptoms that affect their life. Even if they've had an intervention, sometimes that doesn't work very well. So their symptoms continue. Some of the patients we support, they've had to stop working. So, the achalasia impacts people very differently, but it can be very, very kind of disabling and debilitating as well.
Well, that's achalasia, but it is Rare Diseases Day. That's tomorrow. What would you like my listeners to know about Rare Diseases Day, and where could they go for more information?
Yeah, so Rare Disease Day is really important to me personally, but also obviously to the achalasia community, because it gives a voice to the 300 million people who live with a rare disease around the world. And it really helps bring attention to the unique challenges and experiences that people have who live with a rare disease. And it creates this community, the space for for advocating and for better access to healthcare and also increased research. If you want to find out more about rare disease, you played a clip before. There's Rare Disease UK, that's a great place for information on rare diseases. If you want to find out more about achalasia, please visit our Achalasia Action website, and we have loads of information on achalasia there. We're completely community driven and patient driven as a charity, but we work with medical experts in achalasia who help ensure that the information we provide is accurate.
I hope you feel like you've been heard today. I appreciate you coming on to this show very, very much indeed. That's Silvia Davey there, who is somebody who is dealing with and helping other people deal with a rare illness called achalasia.